PRRS is one of the most important pig diseases, as we all know. It has some reproductive programs, it has respiratory symptoms, and additionally also it makes animals more prone for other diseases. So in general it's a very important disease, and economically spoken it's about 4 to 20 euro a pig a year. So as PRRS is such an important disease, mainly the disease is tackled by vaccination. Historically, sows have been vaccinated to reduce reproductive problems, and more we see also piglets being vaccinated, because we see that clinically these animals are responding very well. But one of the main problems up to today was that piglets could only be vaccinated from an age of 2, 3, 4 weeks onwards, so it was not possible with the older vaccines to vaccinate from very early age. Piglets are born with maternal immunity. This can protect them for a certain period, but we see in most cases, in Europe at least, that piglets become infected shortly after weaning, or even during the nursery period. The infection pressure is very high. So if we can protect these animals from a young age, it's really a beneficial thing. So the study, which has been published in Porcine Health Management recently, aimed to show the efficacy of a piglet vaccine administered at day 1 of age in the presence of maternally derived antibodies. So we were looking if we could vaccinate animals already from the first day to protect them at weaning. So the design of the study was to look if vaccinated animals at day 1 of birth derived from sows vaccinated with the MLV vaccine during pregnancy were protected or not. So the animals were infected with the field strain at around 10 weeks of age, when the maternal derived antibodies were gone, and then we looked to viremia, to excretion of virus, to temperature, and these results were amazing. We saw that the vaccinated piglets had a clearly significantly reduced viremia after infection with the field strain. Consequently, this was also seen in excretion. So nasal excretion in vaccinated animals was significantly reduced, which is really important for the field, because it means that these vaccinated animals will excrete less virus when they come in contact with the field virus. So this is really important for the use of such a vaccine at a very young age. If we see that this excretion is reduced, it also means that in a population it can also result in a lower presence of the field virus, and at the end eventually it will fade out the infection if we really have success. But this of course should be shown in a field design or in a field trial. So in conclusion, this study really shows that vaccinating piglets from day 1 of age really protects them from the time that they are weaned, so they are protected during the whole life of the fattening pig. Additionally, for the farmer, it's a really convenient way of vaccinating, because pigs at day 1 of age are very easy to handle, and it's very easy to vaccinate these animals, whereas vaccinating animals around weaning or during the weaning periods is provoking more stress, and it's not really ideal. So this is really a new thing which has great implications for farmers.